Thanks for tuning in, everybody. I'm Dr. Chad Yarbrough, and this is Dr. Melissa Wenrich. We've known each other for a couple years. She's a chiropractic neurologist here in Nashville, Tennessee, specializing in pediatrics. Love her energy. She just spoke at an event we were just at in Liven. We had a good time there. She did a great presentation. So really excited to hear her thoughts on foundational fertility today. I hope everybody enjoys. And I'm going to turn it over to her.
Thanks, Chad. Thanks for having me. Yes, it's neuro's kind of led me. I think when you start working with peds, you kind of go back a few more steps and start working with women, because the goal is to have a healthy babe and a healthy child. It's so much more than that positive pregnancy test. And I think that's what Western medicine is missing, because we go for, okay, you're pregnant, great, we'll see you in a few months. Or even just with postpartum, it's like, oh, you had this baby and we don't see you for 6 weeks. Like, where is the support in any of that? And the system is failing us. It's failing women significantly in this country, and especially in Tennessee. So it's my passion to kind of start back at the beginning and go to this preconception period that is really, it's all about our health. And we're only going to have a healthy child if we are healthy. The egg and the sperm need to be as healthy as possible, because that's what makes this next little soul in the generation. So I'm gonna share my screen. We're gonna just kind of dive through some foundations that I have found to be super helpful. So I've been in practice for almost 17 years now. And over the course of, like Chad said, neuro, really heavy in that. And now I have some great doctors in my clinic handling that. And I've been pushed into this high need of fertility and just handling the infertility cases, because women and couples are not getting help. They just get sent out to the reproductive endocrinologist, and you kind of hope for the best. You shell out lots and lots of money, and there's not a huge success rate in that. The other side of things is that women, we're having careers, we're waiting longer to have kids, a lot of us, and we've lived a lot of time in that period, right? Like if we've gone to school and we're looking at like, oh, we're 35 and we're just kind of settling down and ready to have a family. And we have to really look at the genetic parts of us and our health and our history and our past infections and all these other things that really matter to our fertility. A lot of things that we're seeing in our age group that I am really having, it's kind of that big thing that we're dealing with right now, is most of us have been on oral contraception at some point. So we also have all these factors that we're kind of just catching up with us. And so I think, like, no matter what your story is, and no matter what your health history has been and where you are right now, the things we're going to talk about today, it helps everyone. So no matter where you are in your journey, if for a lot of my patients and clients that we see in the clinic at Nashville Brain and Body, like people, this is kind of the last resort. We see women that have gone through various failed IVF transfers or recurrent losses, and my goal is, before I leave this earth, that we are doing things early. We're doing things before, so we don't have to see these factors. So these are some of my things that I find. Chad already kind of introduced me. My other piece that I just started this year is I started a fertility school with my colleague, Britt Anderson, because we do need more providers. So if you happen to be a provider or want to be a provider and support people in this fertility journey, we need you. We need more providers understanding how to help women in this area. So, like, what the heck is foundational fertility? I think it's so much more than those few labs that you get done at the OB-GYN every year, where they, let's cram a speculum and check that, and let's do a few labs. It's so much more than that. And it's really the most important piece of our health as women. We are very complex beings, and the fertility piece is it's really how healthy we are before that egg is released. That is everything, and that special little egg is our health. So so much in our society, like I said, we wait until there's a problem. And I want you to know that, like, the choices that you start making now really do impact. I have seen it. I have worked with numerous women that have been told they had to have IVF. They had to have IVF. They may have had a baby a successful, like healthy child from IVF. And once we start doing these foundational principles and addressing these issues, they call me and say, holy cow, I'm pregnant naturally. So I want you to know that your choices every day, day in and day out, really do matter, and they really can shift your health. So what are we going to talk about today? We're going to talk about just things to focus on. Okay. Like look at your symptoms. Don't discount your symptoms. If you're having gut issues, if you're fatigued, if you're not sleeping, if you're not pooping, we have to look at those day in and day out things that sometimes in our society have became like normalized for some reason. Like it's okay to have lots of cramps with your periods. It's not normal. That is not healthy. And so really finding a provider to dive in and sit with you and go through each of these symptoms, it is going to shift your fertility dramatically. The big things we're going to be focusing on, because it's where we're at in time. We are surrounded by toxins, and understanding our genes and taking things every day, what we're drinking, what we're eating, and what we're around, and just controlling what we can, because at the end of the day, we can't control it all, nor do we need to be obsessive about it, because our bodies also are very powerful and our bodies know what to do. And we have everything within us to heal and to change, but just being aware of these things can drastically shift us. So we're going to look into some genetics. I've used MaxGen it's been the only company that I've used for genetics with my patients over the last several years. So we're going to look into just a few things that really matter with fertility, such as detoxification and some nutritional markers. And then I'm going to share with you some of the lab markers that I pull initially on all of my fertility clients, in hopes that maybe you can ask your provider to do the same. So before we dive into all these intricate things, I want you to understand at the end of the day, there's no amount of supplements or testing that will outweigh the basics that you need to do every single day. So I see too many times people come in and they've been to good doctors, like people that I've learned from, and they're on, 25 supplements. And then I ask them if they're sleeping and if they're pooping, and they're not. And so none of that is going to matter if we're not doing the basics. So I want you guys to just come back to this: sleep, getting out in the sunshine throughout different parts of the day. Our circadian rhythm is really, really critical for our hormones, for men as well, but specifically for women. We really start to develop those hormones that we need, the adrenals and the cortisol and all these responses that directly impact our progesterone and estrogen and our cycles. We should be with the moon. We are, we really are the women that are supposed to be on the earth and in the grass and, growing our herbs and doing all the things that our ancestors have done. We haven't evolved to not do that anymore. And so that's just, it's such a big piece. Movement, we have to move. We need to be exercising, not over exercising, but just finding that sweet spot of moving. Food, nourishing, releasing anything that we need to, trauma, if you need therapy, that is a big, big part of the fertility piece. And then just connection with others, because a lot of times if you are walking through infertility or have had loss, it can be very isolating because your friends, your siblings, so many other people just don't understand if they haven't been through that. So finding that community is really, really important. So look at the big picture, start there, start with these basics, and then we can really dive into, okay, what's my history? What are the emotional aspects, the physical, what past exposures to things? Where did I grow up? Did my house have mold? Did I get strep a lot as a kid? Did I travel to a lot of foreign countries and have some GI upsets here and there? What does my family tree look like, if you know that? So just really looking at that and making a list. That is where I start. That the history is just, you really get all your answers in the history, because if there are some things like mold exposure or a lot of infections growing up, or even currently in the last 3 years that we've been experiencing and been exposed to, it really plays a role with our immune system. And our immune system is our overall health, which is fertility. what are your current symptoms? Like I said, have you been diagnosed with IBS? Do we have gut infections? Do we have constipation, diarrhea? Do you have fatigue? Are you suspecting maybe a thyroid issue? Some of these big things that really play a role. Just make sure you're doing that. And then look at that environmental and detox issues. We're going to dive into some genes for that. And then just kind of how to deal with that, because in my opinion, we are dealing with environmental medicine at this point of the game. And so we really have to make sure we're supporting liver and supporting our drainage pathways and opening things up. And if you're one that is like, you're sitting here and you're like, I've been diagnosed with thyroid problems. I have PCOS. I have endometriosis. I have, this long list of issues. Just start with the basics. Start with the basics. It's going to shift, because we don't even know, like, if we start tackling all these other symptoms that are at the end, such as, estrogen, progesterone issues, and we've missed the sleep and the food and the blood sugar regulation and all the things that actually create these hormones, we're never going to get there. And my goal too is for you to feel good during pregnancy and to have a healthy baby, and to be able to enjoy that healthy baby. So we're going to walk through a few things. So some things that I'm seeing clinically, and this goes as well to a lot of my colleagues, like we're seeing a lot of these other things affect fertility, because fertility is not on its own. Our fertility is a combination of every single function in our body. So if you have autoimmune conditions, GI, trauma, energy of the cell with our mitochondria, and then if you're in Nashville, I've been seeing a lot of mold, us getting through rainy summer, hot, humid season. So that, parasites, infections. So we have a lot of infections and things that our body, if for some reason your body was unable to take care of that effectively, it could still be in your body. And just because you may have gotten over it, we need to really address that, because it can shift the way your immune system's working and the way your detoxification pathways. And then let's get into those detox and MTHFR and some of these genetics. If you are lucky enough to have some SNPs or these genetic variants where maybe your body doesn't do something as well as someone else's, that's when this can potentially become a problem. A good example of this is when maybe you're in a house, you have your spouses in the house, or you have roommates, whatever it is, it's like your kids, and you're the only one that has the symptom of maybe potential mold, or if there is a cleaning product that has super toxic things in it and no one else is affected by it, and you're over here dizzy, unable to breathe correctly and all these things. So everyone is exposed to the thing, right? But if you have a genetic variant or your body is dealing with something else at the time, you're going to be affected differently. And those are the things that we really want to dive into when we're looking at functional testing, because we want to see, like, what is individual for you. We can't put this blanket statement on every single person. So that's where some of these tests are they're so powerful for the cost. And so I utilize these a lot with people that have had just a lot of autoimmune dysfunction, and just, we're kind of like, what in the world is going on? There must be something underneath that is causing all this dysfunction. The other thing is lymphatics. I think I'm really happy that more and more people are talking about this, of just the movement and keeping our body moving. It really is the thing. If we can keep things shifting and moving through our body, pooping and our liver working and our gallbladder, all these things that we see a lot in women's health become an issue, especially with estrogen and some other hormones. The basics really go a long way. And then I'm a chiropractor first and foremost. So I am just absolutely headstrong on the structural piece of fertility. If you have scar tissue in your abdomen, if you have had injuries in your pelvis, past surgeries, endometriosis, things like that, you've got to restore circulation and blood flow to that pelvic bowl. You need blood flow, you need things to be aligned. It's absolutely necessary to bring that fresh blood and to have room for a babe to grow, but also so you can have a really great pregnancy and delivery. So let's talk about detox, because that's kind of the big thing that I'm super passionate about. And that's kind of what we're focusing on today, because I have found that it has been the game changer for my fertility clients. I've been working with fertility clients for years. But as things have moved forward and we're just around a lot more things than we were 15 years ago when I started practice, when I take a few months and we work on this piece, the results of number one, egg retrieval, which is really cool to see because we have data. So I had a client that I've been working with for quite a while, and she's had numerous egg retrievals. The last one she did was before she saw me, and there were like maybe 2 eggs. They were not great. Things were not good. We did a full panel on her. We did a nutritional, we did toxin panel. We did the works, and we worked for like 3 or 4 months of getting her so healthy. Might have been closer to 6, but we did body work. We did we supported all of her detox pathways. She has MTHFR, and we really, really focused on those things. She had the best egg retrieval. It was like mind blowing. The doctor almost like didn't even know what to do because he was like, what in the world have you been doing? So this works. And when you're seeing data like that, like they're looking in a lab at this egg, and they were absolutely blown away. So I think that's really cool. It's yes, we have this natural ability to detox, but if we are burdened with toxins, we are around things every day, or our body has these potential SNPs with detoxing, it's going to make us really hard to be able to handle the glyphosate that's on our food, or the EMFs that are in our environment, or the mold that could potentially be in our house. So we have a lot of organs that work for us and do this every single day. I just think that we need to support them. The liver, the kidneys, the intestines, the skin, the lymphatic, they all play roles. And this really is impacting fertility in sperm and egg health. One of the things that is a big contributor to this is the endocrine disruptors, because so many things are being made with plastics, and we're cooking in microwaves, and things are heating up, and men are carrying their cell phones right next to their testicles, and it's not working out very well. And we've got to step back and like figure out, okay, like we're not going to avoid all these things, but if we can keep pathways open and trust our body and know that we're going to be able to get rid of these things, I see drastic shifts in people's health and their hormones. Heavy metals are another big thing that I want you to consider. We are around a lot of heavy metals. Women, I tend to, when I'm working with them, heavy metals love the ovaries. And so if you've been around things, or you've had IUDs, you've had, even I go back to like, we've had braces, we're around a lot of things. So just taking a chance to look into that and see if that's a potential for you. And then of course, alcohol. There was a great study. I know we don't want to hear it, but drinking more than 3 glasses a week drastically reduced fertility. So, and that's in men and women. So just being careful of that. And also just prescription drugs, some common things, like we're in a society where a lot of people have metabolic disorders such as diabetes. So a lot of men and women both are on metformin. It's common even for women to get put on that with PCOS. It's not great. There's some pretty nasty studies on metformin with sperm and how it affects. So it's just, if we can make lifestyle changes and take the time and just do that, it's going to really pay off. So let's talk a little bit more about like what this does. So the endocrine disruptors are like all the plastics, and they can really shift our hormone balance. And so if we're just walking into our provider and saying, my periods aren't regular, or I'm spotting, or I don't know if I'm ovulating, throwing on birth control pills or doing this Band-Aid thing, it's never going to get to the root cause. And so we need to figure out, okay, my body's doing this for a reason. So what is the reason? And we can oftentimes, if we just think through that lens, patients come up with that on their own. I don't have to say that. Like, yes, we walk through that, but it's, oh, wait, what if it was A, B, and C? I was around this thing. I got super sick with this infection. And ever since then, that's when my periods were irregular. So, so just taking a chance to look and see when things started, and really looking at that piece of it. The other thing is like the egg and sperm. So going back to that patient, like reducing that toxin exposure will have significant results in healthier eggs and sperm. The other thing at this point is we do have some good supplements to help with that. And so working with a provider that can effectively help you open up those pathways and do those things that affect the egg and sperm, it's really going to pay off. And that's, the antioxidants. There's some great companies that are making very focused supplements for fertility. And, it has your CoQ10, it has your alpha lipoic acid, just some of those good antioxidants that are going to help support those detox pathways. The other thing is just that uterine environment. So thinking about how someone that's open and detoxified, and we want cord blood to be healthy, that is the health of the woman, which is going to be the health of the baby, and making sure that we have a healthy environment and a hospitable environment, especially if we are having to do IVF, because there's a lot of things that get added on to those patients. And I always say you have to be even healthier if you're going to be having to do IVF, because you have to be able to detox a lot of the hormones that you're getting pushed through. So what are some ways that we can just handle if we don't have someone that we're working with? What can we do? Because a lot of these things are free. They take time, they take energy. And so it's our diet, consuming, like whole foods, like getting our food fixed. And that's another thing where this individualized piece and understanding our genes is so important. So like for me, with my genes, I don't do well with carbs. So I know for me, I can't, like, my blood sugar gets dysregulated super fast. My brain doesn't function well. And I have to eat a pretty darn high fat, high protein diet to feel my best and to have great periods. And so that's for me. Whereas like my best friend, for example, she grew up, her ancestors are from Mexico on the beach. So she could like sit and eat fruit and do all these things where her blood sugar stays super, super level. I can just look at that stuff and I freak out because I have like German like blood where I'm just like, I need all the warming things and fat and protein. So that's where like looking at these genes and understanding our ancestry really, really helps to make an individualized plan. Water. We have to drink water. We have to be hydrated. Getting that content right with our salt and helping our cells, that's a big piece that is missed. And then just the quality of the water. So in Tennessee, we have some pretty bad water. You can pull up maps on like the EPA and some different things where they show what's in our water. I can't stress enough, like, please get a filter on your water. It does us no good if we're trying to like take all these supplements and do all these things to detox, and then we are just filling our body with who knows what in our water, and then making it just really hard for our body to handle. And so just get a good filter. My preference is reverse osmosis or distilled. You do have to put minerals back into that. So it's a process. It depends on how much work you want to do. But those are the two things that I recommend, especially if you're trying to get pregnant. Exercise, physical activity. We want to circulate. We want to move those toxins through. And then just, of course, limiting those exposures. So let's get into some labs. We're doing okay on time. So I wanted to share this with you all, not to like overwhelm you, but I want to empower you to ask your physicians. And a lot of labs now, you can even order your own labs. There's a lot of amazing companies out there that are allowing that, which is just incredible, because I think the more we can take on ourselves and empower, and we are our own best doctor. And it's time that we come back to that. And so I wanted to share these with you all and just really focus on a couple of things that matter when it comes to your detox pathways. And something that is not discussed is like, we kind of like go through each section of like, oh, I'm trying to get pregnant. Okay, great. Now I'm pregnant. Okay, I'm only focusing on my pregnancy. And then the only thing we focus on for postpartum is, oh, wait, we're not thinking about the child. We're like, having these baby showers and doing all this stuff, when we really need to be thinking about like, what's really going to matter. And so one of the big things over the last several years that we've been seeing pediatrically are a lot of midline defects. And that means tongue tie. That means lip tie. We actually have a sweet babe in our clinic that's going to be born with a cleft palate in the next couple of weeks. And they just started coming to us. So we're going to be doing a lot of work with that sweet one. But are there things we can do on the front end to prevent that? I'm lucky enough to have some double copies of MTHFR, and I did all the things I could have. I know more now than I did 5 years ago when I got pregnant at 39, and I had done a lot of work, but my babe still has a tongue tie and we're still working on it, and if there's anything I can do to help people not have to go through that, because breastfeeding is hard enough on its own. We don't get the support we need. And then having to walk through all of the tongue tie things and the resources and the exercises and the functional appointments and all these. It's just a lot. So if we can get some labs in a really good spot before, I know that it's going to make a big difference with those. So one of those things you'll see kind of midway down the list is that homocysteine, and we'll go over some nutrients too, but there's just some big ones that aren't getting tested. And I want you to just keep drilling your doctor. I want to get this checked. So homocysteine, our B vitamins are really, really important, our B12. If you're unable to get your genes checked, but with MaxGen, you can get everything checked for a fraction of what they're going to charge you at a blood lab for just MTHFR alone. So that's why we just usually do the whole thing if someone doesn't know. But the other thing is we need to just kind of assume that we probably have some issues. This plays a role when it comes to prenatals, folic acid versus folate. That's where one of those big things comes in. So just make sure it's folate, make sure it's a good form of methylfolate. If you're really into genetics, there's some companies that have some different forms of B12 that are even broken down even more, that have the folinic, not folic, but folinic acid in them. And so even if you don't know and you can't spend the money on the testing, just go ahead and get the prenatal that is suitable for that gene variation. So we really want that homocysteine. It's, I say below 7, it really needs to be below 7 because we're going to have some issues with breaking down, and we need that folate and we need those Bs at conception. It's already too late if we get that positive test, because those things, the neural tube and all of that midline, it's the first thing that starts developing. So just make sure we get those numbers where they need to be before pregnancy. Basic labs, I threw on, our CBC, CMP, which your doctors usually check on you every year, lipid panels. This is a big thing because we've been kind of brainwashed into thinking that cholesterol is bad, and cholesterol is the first thing in all of our hormone cascade. So we need it, and it's not bad. And we need it to be above 150 if we're going to have healthy periods and have healthy pregnancies. So just make sure you're getting that checked and looking into that. Our glucose and insulin and A1C, these are blood sugar markers that are really going to be super important, more so the insulin, because sometimes our A1C can be elevated if we're stressed, if we're going through, different things, adrenal and cortisol, and we have there's some other things that can affect that. But really looking at that insulin fasting is just such a good marker, and it can check and really kind of see if we're going to have these diabetic tendencies years before it becomes an actual thing, which is what we want to do. We want to take care of things before they become an issue. The other things are HSCRP and ferritin, which along with the homocysteine, it just really looks at inflammation and our body's ability to handle things. Are we inflamed? Is our body, just our cells and everything, really stressed out? Because if that's the case, getting pregnant is going to be really, really hard. The last thing, our body wants to take care of us first. So it's going to make sure that we have blood flow and fuel to our brain and fuel to our vital organs. And if we have low cholesterol and low nutrients, which we're going to go over in a minute, and homocysteine's through the roof, and we're not in a good state, the last thing we're going to do is to grow another human. Our body wants to keep us well first. So this is why these are just absolutely important. So here's just a list. And if anybody wants also these at the end, you can have a QR code, so you don't have to take notes on this. I can send you over these things, and I have some list of labs too that you can use for your doc. But these are just basics. There's a lot more tests that we can go into. I love the MaxGen report because it shows, which you'll see in a minute, do we have the propensity to be low in B12, right? Do we have a chance with our genetics to always be low in vitamin D? Do we need to stay on top of that a little bit more than maybe someone else? So I think that's the key in all of this. And so really looking at some of these, and then thyroid's another big fertility marker that gets missed. So the lab range of TSH is huge. If someone can be in the normal lab range with TSH, and I guarantee you are not feeling great. You probably don't want to get out of bed in the morning, but a typical doctor would say, oh, you're fine. It's all in your head. But we need that TSH below 2.5 if we're trying to get pregnant. So just make sure that is checked and you get that below that number, because we don't want to have any miscarriages if we can do everything at all to prevent that. And that plays a big role. The other things that we're going to talk about is the good stuff. So these are just some screenshots of what, if you haven't done a MaxGen report, these are the things, a couple of pages that are just really, really important for fertility. And it really gets down to what we've already talked about. It is how well we are detoxifying, how well our organs are able to get rid of things, because that is the ability for us to have healthy egg and healthy sperm at the end of the day. The other thing too is our estrogen. So estrogen, we need estrogen. I feel like almost in the functional world, we're kind of getting to where estrogen's even bad. It is not bad. It is very, very necessary, but the way we are detoxifying estrogen is important. And there's some other labs for that. If that's something that is, if you have breast cancer in your family, and just some different things that can be checked. But so the PON1 gene is just really tells, if you're the person, if you're like me, you can smell someone spraying something like 10 miles away. You probably have some detox variations where you're not able to handle things. And so handling this, and then the acetaminophen, which is Tylenol, which in my opinion, we don't need it. It really can screw us up. It can mess somebody up that's super healthy, much less someone that has some genetic variants. And it really affects our glutathione and the way that our antioxidants and the way we're able to detoxify. So those genes, the big one too for glutathione, I think that's a big thing, because N-acetylcysteine is kind of a big supplement that a lot of docs prescribe and use, and a lot of people come in on it. And we need to make sure that we're even able to make glutathione from that. Some people actually aren't. And so NAC is kind of the precursor to that glutathione. So looking at this GPX and GSTP1, like that's super important for like looking at these glutathione and how our organic acids, and just really diving into that. Maybe Chad needs to you just need to do you probably have a whole lecture on this already, but yeah, just being able to dive into these just like few detox things. I think we could talk about them for a really long time, but just knowing this, then we can be, okay, I am more susceptible to things around me in my environment. I'm going to have to be on top of taking and doing, like getting in the sauna, making sure I'm getting my walk in. Maybe we do assisted lymphatic therapy. We do Epsom salt baths. We do some gua sha and movement in our face and our lymph. And then we take some liver support. And so it doesn't have to be scary. It's power to know these things, because then we can be on top of it, especially if we're actually experiencing it. And then the estrogens, one of the big ones that I always look at is the COMT. So this helps us to know if we're going down the right estrogen detox pathways. And so we have three main detox pathways, and we want to go down a protective one, which is the 4OH. And a lot of times we're unable to do that if we have some detox issues elsewhere. And so just knowing this, it gives you a lot of power and understanding why you may be experiencing heavy bleeding, clots with your periods, and pain. This is a big one that I see, is with the COMT, and then just not able to detox our estrogens down that safe protective pathway. The next thing is HFR. So this is a big one. It's been around a long time. We've known this. We know there are studies galore that this gene will affect your fertility. It's big with midline defects. So if you already have children and they have tongue ties, I would put my money down that they have at least one SNP in this gene. So you need to be aware of that, because that means they're not as easily able to detoxify things that get put into their body. And just knowing this is knowledge. And I actually did a MaxGen report on my child when he was like 5 months old, because I know I have double. This is actually my test. So I knew what my health is, and I just wanted to stay on top of it and just have that knowledge. And so MTHFR really helps us with the folate. That's why that is important, is that we're taking folate, methylfolate versus folic acid. If we have one of these genes, most of the time I see the two common ones, which is the C667T and the A1298C, those are the two most common. There are a lot of other gene mutations. And as we're, obviously studying DNA and genes more, we're uncovering that. But these are the two that can cause a big problem. It really also comes down to being able to develop that neural tube. We don't want to have any midline defects. But the other thing is for pregnancy loss. Whenever I see this too, we always want to ask the doctor, like, make sure that we're checking some like more thrombolytic. So like, are we having clots? Do we have this susceptibility to create more of that embolic arena in our body, which could cause a miscarriage? And so these things do matter. And a lot of doctors, unfortunately, will say that it doesn't matter, but just keep finding a provider that'll hear you and listen to you, because supporting this gene variation can make or break a healthy pregnancy. And also just as we get older too, like the cardiovascular effects, you can see it, just anxiety, depression, cancer, bipolar. It's just, there's so many things that if we can detox and know our body and support this, we can change our life and the way we feel every single day. So this is key. The other ones, if you have a tendency to have depression, anxiety, some of those, that rolls in back into that homocysteine that I was talking about. And we have something called the SAM, and that's a whole nother thing, but just the way we break down like methionine and some of these other nutrients in the wonderful chemical reactions that our body does. If we have a problem with that, it's always like, are we slower than the average, right? Like, are we slower at taking care of this particular chemical reaction? Do we not have the enzymes? Does our body not produce enough to make this the way it's supposed to be? And then we have a buildup of things, right? Like, that's how I want you to look at it. Like, do we not have the tools already to make this happen? And then we get all these symptoms, right? So what can we do? Can we come over here, and once we know these things about ourselves, and come in and support and add some more tools, right? And that's where the supplementation comes in. Can we do some more tools? Maybe we need to take more B12 than someone else to make sure all of this process works correctly. And then we all of a sudden feel good for the first time in our lives. Like, this is it's really individualized care. And I think that's what it is so oftentimes we get pushed into these like diagnoses buckets of what we have, and we get labels and we don't really get answers. And the answer comes back to, if two people have infertility, or maybe we have endometriosis, the causes of those two individuals to create that diagnosis could be completely different. And knowing the most we can about ourselves and about our clients and about our patients is just, we're going to have just dramatically different outcomes with that. And so I urge you to just learn. We need to take control and have responsibility for ourselves and our health. And the more we do that, and the more we can empower and like ask questions, like when we walk into a doctor's office, like the patient is in charge. It should be the other way around. And the more I guarantee you, just even knowing a few things about MTHFR, you'll know more than your OB-GYN does. They don't get it. They don't get it in school. And so it's just, we have to do this stuff and find people on your team that'll listen to you and hear you. If you're suspecting these things, there's so many amazing providers that care and that are diving in and will be straight up with you and tell you, what, I'm not sure, but we're going to figure it out. So just keep fighting, because I feel like this women's health battle we're just getting started with it. And yeah, Chad, do you have anything else to kind of throw in there on these genes? I don't want it to make it, obviously too complicated either. So and then while we're chatting, here's my last, if anybody wants to scan that, you'll get in my email. So you'll have to like kind of opt in for legality reasons. Do that. And then if you want a copy of this particular, like if you want my actual slides, just send me a message back from the email once you get on my list, and I'll share. And if there's anything else I can help you with, I'm so happy to do that. And yeah, everybody's got that.
No, I don't have anything else to add. You did a fantastic job presenting.
Thanks.
No, those detox genes are huge.
Huge.
And, taking the preconception, taking this seriously before you conceive is such a huge thing. When I practiced, that was a big, give us at least, 6 months, to try to get things optimal, so you have an optimal pregnancy. And I think And a lot of infertility falls into that. And it's not all about just infertility. All of us need to be doing this. Our autism rates are 1 in 30 or something. And there's
It's
so much we can do with that, with glutathione, and we have research to back up what we're doing with this stuff. So I think it's a huge, huge topic. And, maybe we should have another webinar and we discuss the detox genes. I think that'd be a great follow-up.
Yeah, I think people need it. And just the more education, that's the thing, is like, we've got to educate people, right? And like, the more we know about this, we're going to show up, and that demands medicine to change.
Correct.
Right. That's the only way, is we're going to demand, we need this to be better. And I appreciate everything you guys are doing at MaxGen, because it's like, it really does, for people to see that. You have no idea, especially over the last, just the peds cases, like, can we please do this? Because I need you to see that we can't keep doing this thing. Your kid is really sick, and it's so important, that preconception. It's just that whole period, which is why I stepped back. I'm like, my providers over here can take care of the kids. And I'm like, let's go 3 steps back and take care of the egg and sperm first, because I really do. I remember when I was in my neuro with Dr. Malillo, that was my first class I took, was peds. And it was just like, so much of this could be prevented in preconception. So much.
Let's talk soon. Let's do another webinar. I love that. So I'd love to.
I hope it helps. I hope it helps someone.
Yep. Well, we will have this. This has been recorded. We're going to, edit us talking in the beginning about our heart rate variability out, and we'll repost it so everybody can share it. This is such an important topic. Everyone listening, I really encourage you to share this. It's invaluable for families to know this before they even try to conceive. So definitely a huge topic. But I want to thank Dr. Melissa. Really appreciate it. And thanks for tuning in.
Thanks. Bye.
See ya.